Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the hip joint biomechanics, in which we'll talk about the acetabular labrum, which is a protective structure in the hip joint. So the entire periphery of the acetabulum is rimmed by a ring of the wedge-shaped fibrocartilage called the acetabular labrum. And the labrum is attached to the vertebrae of the acetabulum by a zone of the calcified cartilage with a well-defined tide mark. And the labrum deepens the socket, increase the concavity of the acetabulum by its triangular structure. And the stability is increased by deepening the acetabulum, also acting as a seal to maintain the negative intra-articular pressure, and it decreases the force transmitted to the articular cartilage and provide proprioceptive feedback. So the transverse acetabular ligament is considering as a part of the acetabular labrum, positioned to protect their blood vessels passing beneath it to reach the head of the femur. Third is the head of femur. The femoral head convex surface of the ball and socket type configuration of the hip joint forms a 2/3 of the sphere. It is a fairly covered by hyaline cartilage, most thickest as the medial side around the fovea or fovea capitalis. The fovea is a round hand of the surface present slightly inferior to the medial most point, which is not covered by articular cartilage, and is the point where the ligament teres or the ligament of head of femur is attached. And the cartilage of the hip joint is viscoelastic, which influence the loading pattern on the femoral head and based on the magnitude of the load applied. Fourth is the femoral neck. So the femoral head is attached to the femoral neck, and the neck is to the shaft of the femur in between the greater trochanter and the lesser trochanter. The femoral neck is about 5 cm long. Femoral neck is angulated, so the head faces superiorly, medially, and inferiorly with respect to the femoral shaft and the femoral condyles. There are angulation made by the head and neck of the femur with respect to the shaft. And there are two angles made by the head and the neck of the femur along with the shaft of the femur. So first is the angle of the inclination. It is the angle between the head and neck and the shaft of the femur, and it is about 140 degree to 150 degree at birth, then decreases up to 125 degree. And if it is more than 125 degree, it is known as coxa valga. If it's less than 125 degree, it is known as coxa vara. So this figure represents the increase of the degree of the angle of the coxa valga. So this figure represents the coxa vara. Thank you.